Hey everyone, Kate Bodette coming at you guys here for my final project of Professor Stan Reilly's public health or health policy and management course at Herzing University. And this project is being completed on August 23rd, 2020. So thank you for being here with me. This has been a super amazing semester for myself, and I've really been able to focus on things that have been important to me as far as health issues and policies, as well as looked into other issues that I may have not previously looked into just because they weren't at the forefront of the community that I live in. And so for this project, we were able to kind of select public health legislation that was important to us and our community. And one of the common themes for myself this semester, as you may have noticed, is focusing on the growing need for the obese population. And so this project that I focused on this week and the paper that I wrote for this week really focused on obesity legislation that's currently out there and how we can better serve our obese population in Chippewa County. So as with any public health department, public health in Chippewa County is hugely imperative. They take care of so many people, from itty-bitty young babies with WIC to elderly patients, making sure that they have the resources in home or in nursing homes that they need, and everything in between. And so obesity is just one of the many, many, many things that they take care of. However, we don't really have any legislation in our community that deals with obesity and how we are taking care of those patients, which is truly a shame, because when I was researching, 28.4% of Chippewa County is considered obese. That does not include the additional percentage of people who are overweight and on their way to becoming obese. And if we don't get those numbers under control of those overweight individuals, they're going to soon join that obese population, which is already over the state average. So this is an issue that definitely needs to be addressed. And it has to be addressed creatively, because we live in a pretty interesting community, a very vast variety. We have farmers that live 40, 50 minutes, maybe an hour away from the local hospital. And we also have little cities who maybe have to travel 15 minutes to a hospital. And so we really have to cater to the needs of all of these patients, because it's not just our patients that live close to the hospital that we're serving. We are serving these people that live far away, and providing care for obese patients when they live an hour away from the hospital can be really, really difficult. So I have come up with a really cool plan and found some really fascinating information. So I'm just pulling up my little chart here, and I'm gonna kind of discuss things with you. So I did a needs assessment of my community. And as I said, we can see where needs are not being met and create a plan for those. And so where I really saw that the needs were not being met were for those patients that live, maybe a half hour, 40 minutes, hour away from the hospital. It is really difficult for patients to continually have to come to the hospital for appointments. It's hard to get transportation. And so distance, transportation, or any other reasons really play a huge factor in our ability to care and treat the obese population. And as we know, obesity isn't just that in itself. It's a high cost across the board for healthcare. So not only are we helping our patients, we are helping the system as well. And so I thought this was pretty interesting. I found this from the Harvard School of Public Health, and this quote just says, "Obesity plays a significant role in the growing cost of healthcare. Obesity leads to other medical problems such as diabetes, hypertension, and heart failure, just to name a few. When an individual has multiple health concerns, they, as a result, require more medical attention. That includes lab work, surgery, therapy, and medication. Additionally, the cost of obesity is as high as it is frequently results in disability, work injury, and increased insurance rates." So not only are these individuals suffering because they are obese, they are suffering from heart problems, they are suffering from medical bills, they are suffering from disability that they can't work, and then their medical bills grow and they can't afford their medical bills, they can't afford medications to help them. So this is just like this vicious cycle. And so I was like, thinking to myself, how can we better address this population, especially for people who live further away? It's really a shame that patients have to drive an hour to have maybe a 10-minute consult or a 10-minute, nurse update check to see what their vitals are doing or see what their weight is doing. And so what I really looked into was telemedicine for the obese patient. And as it stands currently in our state, in our county, I should say, I looked into it. Most insurance companies are not reimbursing for telemedicine consults for obese patients, which I think is really a shame. And so that's what I really wanted to focus on. And I found some really fascinating information that kind of will plead our case. So I'll be going into detail about that. And so telemedicine can be adapted for obese care, and traditional obesity counseling is delivered by office-based physicians who have a considerable gap in knowledge of obesity therapies and management. Furthermore, PCPs have little time to deliver reasonable behavioral strategies to alter nutritional and lifestyle habits. Blanket statements are often the norm, and PCPs perceive that a lack of time, educational materials, and knowledge account for the poor care. One means of task shifting within a busy primary care environment would be delivering telemedicine using healthcare personnel, including health coaches, dietitians, and peers. And that came up from a study that was performed in 2017 by Patisse, Pletcher, and Stahl. And so looking into how telemedicine improves patient care, especially for those with obesity, one of the main benefits is just the improved access to healthcare. Simply being able to see a healthcare provider or a specialist. And I found from another site, the National Conference of State Legislatures, that improved access can bring increased use of healthcare services, and most agree that telehealth services would be the most appropriate and less costly, so more cost effective. And it's been found that living in a rural area actually has detrimental health effects on people. So simply because somebody lives an hour away means that their health is a detriment to themselves. So these areas lack grocery stores, they lack fitness centers, they lack healthcare facilities. So these patients are really left with not a whole lot. And they have to they have to drive to seek medical care, and they have to drive further to seek specialty care. So these patients are often driving, in our area at least, sometimes in upwards of 2, 3, 4 hours. So that is something that needs to be fixed. And they need support during these weight loss journeys, and so driving 4 hours is not getting the support that they need. So I found some interesting information here that a distance between a patient's home and primary care practice may be acceptable for occasional intermittent visits. However, long-distance traveling for a 15-minute visit may be a problematic barrier, which is a barrier that can be compounded by weather-related concerns. I live in the state of Wisconsin. I'll tell you that our winters are long and they're harsh. I would not be driving 2 hours for a 15-minute appointment. So can you imagine that these patients that we're seeing are going to be driving an hour for this medical appointment that's maybe going to last them 15 minutes to a half an hour? I don't think I would. So by working with these individuals to have access to a provider without having to travel, we are better serving the patient. We are being more cost effective, not only for them, but for ourselves. And with weight loss in mind, having telemedicine is an excellent way to check in with a patient and keep them on track and keep them motivated. I have been there. I think we've all been there. Even getting to the gym some days is difficult. You have to have real drive. And so for these patients who are trying to lose weight, it's really good to have somebody that can hold them accountable and check in maybe once a week, twice a week, just a quick phone call. Hey, seeing how things are going. And by providing those services to them, we are actually making sure that they're going to be more successful on their weight loss journey. And so another issue that was brought to the table was issues of insurance. And so I found that for Medicaid patients, reimbursement of services must satisfy federal requirements of efficiency, economy, and quality of care. So each state has the flexibility to cover to the extent of the medical care, including types of telemedicine, how it's provided, and the types of practitioners and the fees that they will reimburse. The absence of a consistent, comprehensive policy for reimbursement is a serious obstacle to the integration of telehealth. And that's also from the Baptiste, Pletcher, and Stahl study that I was reading. And so by having a plan for telemedicine and bringing it forward and creating legislation, we will be better serving this patient population. And another study that I found said that by performing, they had participants that performed a 12-week study that had positive results. Patients were given access to one-on-one sessions, study materials, and monitoring devices, including blood pressure monitoring, heart rate monitoring, and weight monitoring. So just 3 simple little pieces of equipment that this patient can have at home, and then a one-on-one counseling. According to the study, participants were given weekly telehealth for weight loss sessions, and they lost an average of 16 pounds. The control group only lost 3 pounds. That's a huge, significant difference. And those who received telemedicine sessions twice a week lost almost 20% of their body fat, while the control group only lost 3% of their body fat. So those results speak for themselves, just in a short 12-week study. So telemedicine to support our patients' weight loss is an excellent way to increase compliance, to give them support, and to keep them accountable. This is a brand new way for us to help serve our patients, and we've been using telemedicine for so many other things that I just feel like if we could come up with legislation to say, hey, state of Wisconsin, we need you to back us. We need you to make sure that this is accessible for patients. We need to make sure that insurance companies are covering this. These are the results that we're seeing. And really say, this is what needs to happen. And by coming at them with so much research and so much just evidence-based practice, we can hopefully create a change for these patients. I looked at the implementation, and obviously creating new legislation and implementing a new change is difficult, whether you're doing it at a super small facility or you're doing it, like I said, statewide. So we can acknowledge that there are going to be some difficulties that we reach when we're trying to get this set in place. But I said by working with individuals of all the different groups of people, so insurance companies, physicians, state representatives, patients, nurses, I mean, the list could go on and on. By working with this group of people, we can address issues before they happen and kind of come up with a game plan for how we're going to address them down the road. And so we will be better prepared, and therefore, whenever we are able to launch this initiative for our community members, we will be able to provide the best level of care for them. Additionally, as part of launching any new type of system, especially with telehealth or any new legislation, truly we need to be reassessing kind of what we are doing. So I recommended that assessment is imperative, and I would say even just like at a 1 month, maybe 3 month, 6 month, 12 month increments, just to see from the patients and from the staff how things are going. What could be improved? What's going really, really well? What do you think we could do down the road? How can we better improve this system and better serve our patients? And so we can use surveys. I know when we recently implemented telehealth for the use of COVID patients, we sent out surveys to patients as well as providers. We got excellent feedback, and we have gotten it down to an art. It's beautiful. It works so well. So once you kind of get a flow of things, I feel like it works well. And so in conclusion, telemedicine is a cost-effective, efficient way to provide patient care, and especially to those suffering from obesity. Telemedicine concerning obesity can result in increased compliance, increased weight loss, and a healthier lifestyle. And by providing the service to patient, we can reduce travel times, provide support or increase support, ensure that these patients are staying on track and have some accountability. Telemedicine has been beneficial in so many other aspects of healthcare. It has cut so many costs for our systems. It has provided stroke care to patients. It has provided cardiac care to patients. It has provided COVID care to patients. It has done so much. And so by us going towards our legislators and showing them, hey, this is what we've done in so many other aspects of care, and we really think this could better serve our obese population, I think that if we implement it, it will work, they will come, and we will help more people. So thank you so much. I do have a paper that is written along with this that you can see all my statistics, all my references. I have some pretty cool stuff in there. So certainly if you have any questions, feel free to reach out to me. I have done lots of ample research on this topic. It's something that's really, really close to my heart. So I'm hoping that I can email some state legislators and see if we can maybe get the ball rolling regarding some of these things. So if any of you guys have any additional information or have anything that you think would be beneficial to me reaching out or implementing the system, please feel free to let me know. I look forward to hearing from you all, and I hope you all take care. Bye.